Welcome to this series of videos related to curriculum development in health professional education. My name is Mohamed Hassan Taha. I am medical educationist with the passion to advance health professional education in order to improve the population health. Today's session is a very important session, and this video is one of the most important video as part of the series related to curriculum development in health professional education. And this video will be about curriculum review and evaluation. It's very important to know the knowledge related to curriculum review and evaluation, because curriculum is the living document. It's the living, and it's part of the educational system, and it's the heart of the medical and health sciences school. So for this reason, we should take this issue with full attention, how to review the curriculum and evaluate it in a clear way. So what is the strategic importance of curriculum evaluation? And the curriculum evaluation ensures the health professional education produce graduates capable of meeting the health system needs and the community needs. This is the strategic direction. Unlike the traditional education evaluation, health professional education evaluation must consider patient safety, workforce distribution, and service delivery outcome. For example, a curriculum producing high academic achiever but low clinical confidence represent educational success but system failure, and we don't promote this kind of evaluation. Evaluation, therefore, operate simultaneously at educational quality level, institutional accountability level to the community, and health system performance level. And we need to define the term and differentiate between what do we mean by curriculum review, evaluation, and educational research. Curriculum review is a periodic or judgment focus, and judgment focus typically occur during accreditation or scheduled program review cycle, while curriculum evaluation is continuous and improvement focus, not judgment focus or periodic focus like review. And it's the aim of curriculum evaluation is to provide actionable data to decision makers. Educational research aims to produce knowledge and theoretical advancement. We need the three part, but we'll focus here on curriculum evaluation in this session, which is related to continuous and improvement of the curriculum, and the aim to provide actionable data to decision maker. So evolution of the curriculum evaluation, thinking in health professional education. Early evaluation focus on whether the objective is met or not, while the new evaluation style of curriculum is focused on the graduate outcomes, competencies. Does the graduate meet the social health system need, the social accountable? So the current evaluation models integrate the competency-based education, work performance, professional identity formation, health system responsiveness, and social accountability. Several frameworks that can be used in curriculum development as well as evaluation. Let's go through the Kern 6-step framework, and we have discussed this in one of the video in this series related to curriculum development in health professional education. We encourage you to watch this video. So the Kern step 6-step framework starts with problem identification, need assessment of the target learners, goals, objective, educational strategies, implementation, evaluation, and feedback. And Kern position evaluation as a continuous feedback mechanism across the design of the curriculum and development of the curriculum. And evaluation inform whether the problem statement remain valid, need assessment remain accurate, objective remain aligned with the healthcare need, teaching and strategies remain effective, and assessment also, implementation remain visible. So evaluation is a dynamic, not terminal. It is a dynamic and continuous process. We have multi-level curriculum evaluation. And this multi-level should occur simultaneously. For example, session level improvement may be translate to program success. Program level may translate to enhancing societal benefit or impact. We should ask this question to advance evaluation in health profession education. And evaluation must answer this strategic question. Is the curriculum relevant to health priorities? Does it produce safe and competent clinicians? Does it improve healthcare access and quality? Does it support health system and sustainability? We should think about which framework we will use in evaluating the curriculum. And there is no single framework address all evaluation needs. So the guidance here or the advice is to combine the framework. For example, we can use CIPP model, and I will explain it in the next slide, for structured program review, and we can use logic models for mapping. What is the CIPP model? CIPP is for context, input, process, and product. And actually, the CIPP model supports decision making across the curriculum lifestyle. It is especially valuable for accreditation and institutional governance because it evaluates the relevancy, the design quality, the implementation quality, and outcome effectiveness. And as you can see here in the screen, for the context, we should answer this question. For the input, we should answer this question. And for the process, we should answer this question. And for the product, we should answer this question. Detail about these evaluation models and the other will be available as a part of series related to program evaluations. I encourage you to screen this to take a screenshot for this slide so that you can review it in detail. Other model is called Kirkpatrick model, and it is useful for structured outcome tracking, but lack the contextualized sensitivity like CIPP model I described before. And it is the most useful when combined with the system or other approach models. And the Kirkpatrick models, the old one in the left side, start with this reaction, learning, behavior, and result. Reactions about how the learners or the students perceive the training or education process. Learning is about what they learn and to what extent they improve their knowledge skills in the curriculum. And the behavior, to what extent there is the change in behavior when they went to the training site. And the result is for about the overall impact of this program or the curriculum. And now, and recently, the fifth level introduced, it's about return on investment. So this is very important, also one of the models that we could be used. The logic model in educational program design and evaluation, it create causal pathway between the resources and expected outcomes. It supports evaluation planner and stakeholders communication, and it's particularly valuable in grant-funded and national reform of the curricula. And this is a logic model including the input, the output, and the outcome and the impact. For example, for the input, we are assessing this, and for the output, we are assessing this, and for the outcome, we are assessing this area. This example of using this logic model as evaluation model in evaluating the curriculum. Health profession education is the complex. It's not linear evaluation. For this reason, the linear models has been criticized. Therefore, when we evaluate the curriculum, we must therefore track the pattern interaction, not only the linear and the causal and the cause-effect relationship. It's very important to go back to the central goal of the curriculum on medical education, health profession education. Our goal is to improve the population health. So evaluation must measure the alignment with the community need, workforce distribution, outcomes, and health equity contributions, and engagement must be included in as data resource. we should consider the data ecosystem for curriculum evaluation, because high quality evaluation requires triangulation. There is no single data source, and no single data source could be considered as sufficient. So performance data must be interpreted alongside the context and experiential data. We have to use mixed methods, not only relying on the surveys or the quantitative methods. And this is essential for policy influence and scholarship. We should never forget the hidden curriculum. Why? Because hidden curriculum strong influence the professional identity. And evaluation require qualitative methods capable of capturing the culture and the behavior which represent the hidden curriculum. Multiple stakeholders experience curriculum differently. They should be included. And inclusive evaluation increases the validity and legitimacy of the evaluation finding. There is a very important issues to be considered: the governance of the data and the ethical considerations. Continuous quality improvement cycle. Evaluation is the continuous process. And we have to also to consider the common evaluation failure. Common evaluation failure including measuring metrics instead of measuring the outcomes. It's very important also to convert evaluation into scholarship, because high quality evaluation can produce high impact publications, and you can help others to learn from your experience. And the future direction in curriculum evaluation will integrate real-time monitoring. We can use AI, prediction models, and population health linking. The final take-home message here: evaluation is the continuous and systemic. Framework selection must match evaluation purpose. Mixed methods produce high quality insight, and social accountability must be evaluated, not or assume that we are social accountable. Thank you so much for watching this video, and look forward to seeing you in the rest series of these videos.